Stefan Gijssels from the Digestive Cancers Europe. He's the CEO, and he's going to, as someone who organized the summit, very clearly has a vision for what they'd like to see and the role of how patient organizations and citizens groups could help to make it happen. Stefan, the floor is all yours.
Thank you, Tanzin. And I can manage the slides, that's even greater. So I want to thank everyone, first of all, before you leave, not only the presenters and the participants for the lively debate, but I think especially the screening agencies for all the work that's being done behind the scenes. I think patients are usually grateful for doctors for treating them and obtaining results. But the ones who are preventing people from becoming patients or getting early detection are often forgotten for the great work they do, often in not very encouraging environments as today in a COVID situation. So thank you for that, and thank you also for the collaboration, and we'll move forward together, hopefully, to make things even better in the future. Talking about COVID, we're working on a number of tools, and this is an overview of the decrease and the uptake of colonoscopy as a result of the corona crisis. So you can see very clearly that in April, most countries were at a really deep situation with sometimes 90% of colonoscopy just dropped away. Some countries still maintain some 50%. You can also see that quite a number of countries are back to where they were a year ago, which is fine, but that does not, of course, include the backlog of patients that were not treated or diagnosed in the beginning of the year. I mean, according to the Belgian Cancer Registry, around 20% of colorectal cancer diagnoses we have less this year than last year. So as a result of this, and so that means that these patients will be identified at a later stage and probably will require more complex treatment than they would have had in an early detection environment. So for this remains for us a major challenge to make sure that that is picking up again and that patients are treated in the best, detected early and treated in the best possible way. We developed also some tools on our website, so please check it out, digestivecancers.eu. So for colon cancer, rectum cancer, but all other types of cancer, we have interactive country maps. You can click on countries and then you can have, like here, France, Germany, and Slovenia. You can immediately see the cases, the mortality, which screening technology is used in each of the different countries, what the target population is, and what the screening participation rates are, and whether a cancer plan has been updated recently or not. If you have any more recent data, please let us know, and then we'll complete this overview. At least you can then check where you stand vis-a-vis neighboring countries and best practices. We've also developed a health economic analysis that does not only take the medical costs into account by country, but also the informal care and the indirect costs. So if we talk about the cost effectiveness of treatments, obviously more aspects need to be taken into account than only the medical costs. You know, patients have costs, and premature mortality and morbidity, of course, also play a role. So also that's available from our website. We also produced two documents. One is the white paper on colorectal cancer screening in Europe, and that is actually a policy document that explains why it is important, gives some of the business case, also from a financial perspective of why it is important and how it saves money. And then the colorectal cancer screening roadmap is a kind of more operational brochure explaining what can be done with case studies from different member states. This for us is the big challenge. I mean, sometimes I get asked by physicians, why, I mean, you're patients, why do you bother about screening? I mean, that is something that's addressed to citizens. Of course, I mean, it's a bizarre question because we would have preferred to be detected early. We would not have had metastatic cancer. We would not have had, long chemotherapy and complex surgery or radiotherapy with long-term consequences of the disease and the treatment itself. So as patients, of course, we would like to see less patients diagnosed in the future. At the moment in colorectal cancer, the current average of patients diagnosed in stage 1 is around 13%. And I think that is very, very low. And I think it should be everybody's ambition to go where some of the best practices are that we heard today. So the Netherlands has 48% of the patients participating diagnosed in stage 1, which is an amazing result. And I think that is the big gap that we have to work on. So if we think about developing a dashboard, I think this is one that we critically have to have. How many patients do we diagnose in stage 1 with colorectal cancer? And that will make a world of difference in terms of overall survival, because as you know, stage 1 is 90%, and the cost of being diagnosed in stage 1 is 1/10 of a metastatic colorectal cancer. So a lot of lives and a lot of money can be saved in that way. For the whole of Europe, so all the whole continent, if everybody had that best practice, 130,000 lives would be saved annually and 3 billion euro in the healthcare system. I mean, a recent analysis went even further and looked at what it might mean if you also include premature mortality and morbidity, and would come to a saving of 5 to 9, or let's say 10 billion euro every year. So amazing figures. I think if anybody is concerned about the business case, I think this is something definitely we will work on. It's very important to bring that to the surface and use that as an argument to convince national and regional authorities to invest. And that brings me to, our policy ask. And I think we as a patient community in Europe, we're part of the thematic network that the European Commission set up as part of their EU health policy platform, where each year 3 topics are identified. And we thank the Commission for the collaboration in that respect. And so over the course of this year, we've had 2 webinars on colorectal cancer screening, and that results in one joint statement. And so the idea is that if this joint statement is signed by all of you and then many people interested in advancing the case of screening, that will also put into practice. It will be a powerful tool and will be presented to the European Commission in January. At the moment, it's already supported by all the members of Digestive Cancers Europe, so that's 32 organizations across the region. But of course, we need broader support, and that includes yours. Our statement is relatively simple, and it's available on our website. Basically, it has a number of recommendations for member states, for the European institutions, and then for other stakeholders as well. Simply put, the first one is make sure that we have national implementation plans to achieve the committed goal of 65% participation rate among citizens between 50 and 74 years old as a multidisciplinary and multi-stakeholder effort. So this is the goal, and I think this was already mentioned in 2003 in the Parliament resolution, I think repeated by the European Commission's quality guidelines. So let's work on that. I mean, it's aspirational, but I think it's essential that we use that as a target to work on. Secondly, to invest in annual inputs and outcomes metrics. I think we owe it to ourselves to evaluate how much is invested and what the result is in terms of patients diagnosed in stage 1. I mean, this is one metric. We have to reduce the number of people diagnosed in stage 3 and 4 because they cost a lot of money. But of course, even more importantly, these are the most deadly stages, as you all know. 3, we have to invest in technologies and human resources. So putting money on the table is nice, but you need also the infrastructure and the people with the right qualifications to do the work. 4, to ensure that total health economic value is measured. So it's very important to be able to make the business case, not only at regional level, but also at national level. And then 5th, ensure coherence and consistency of the political vision and health policy approaches at local and national level. So sometimes there are countries where the regions have to invest, but then the health economic benefits are at the national level. So the prevention is regional and the curative budget is at the national level. So people investing at regional level never see the value of what they generate. So there needs to be more coherence between these different approaches. At European level, we want to ensure that all EU member states apply the best practices in colorectal cancer screening. So that's why we asked to have a common platform. I think that was already discussed today. And I think this is one of the topics that is very dear to our heart. And we are willing to take a leading role in that to make that happen. And that's the reason why we organized this summit today. And moving forward, we'll be more than happy to continue this effort. And then last but not least, commit and participate to provide support, insights, and expertise based on every stakeholder's competences and possibilities. So that includes all the stakeholders that we invited today. So it's the pharmacists, it's the GPs, it's the regions, it's the health authorities, it's the screening agencies, the registries, the clinicians, the endoscopists, and of course the patient organizations. And I'm surely forgetting the IT people and all the other ones involved. I think we can do a lot together. I think adding perspectives will make it a little bit complex at the beginning, but I think it will make it richer at the same time and more valuable and sustainable also. So these are the 8 asks of our joint statement. If you can, please, I would welcome you to sign it. You can either do that by logging into the European Health Policy Platform of the European Commission, where you find the link here. We'll send you an email, don't worry, with all the details. Or you can send us an email to our general email address, and we'll make sure that your name of your individually or your organization is added to the signatories of this joint statement. So this is a great achievement that we would like to do. In the short term, you will have a meeting report of today. I mean, we will draft all the comments, all the questions in the chat. We will not repeat, but I think we will select them and group them. The videos of today and the presentation and the panel discussions will be in little blocks on our website. We will be organizing a webinar at the end of February to launch European Colon Cancer Awareness Month. That is taking place in March of next year. And then we hope to have a screening summit again next year. I think if everybody is happy with what we did today, and I see from the chat that many people are quite satisfied by what we did. So we'll hopefully do that again. And then of course, create a European platform for screening agencies and other involved stakeholders to make screening and the application of best practices a reality. So this is basically our conclusion. I want to thank the colleagues from Digestive Cancers Europe, the board and the members for having set it up and supported us. And I want to thank you all for your participation. Together we can make the difference, overcome barriers, advocate for more robust screening programs and better funding and long-term investments, because that's our goal. Anything that can be done to prevent citizens from becoming patients, we will help to achieve. So work with us, and we thank you for your participation. And I also want to thank, again, as mentioned before by Dora, European Commission, IARC, Eurega, and WEO for their support and participation. And I also want to thank our sponsors, Johnson & Johnson, Icon, Olympus, AstraZeneca, Norgine, and Servier for their financial support. And I want to thank you all for your great participation. Thanks.